Hello, Kyle. Could you introduce yourself and could you tell us about your current situation?
So my name is Kyle Bailey. I live in New Jersey in the United States, and I am currently stuck at home in quarantine. I don't have the virus. Of course, I haven't been tested, so I can't be 100% sure of that, but I have no symptoms, but I've been trying to not go out of my house for anything other than groceries and just trying to stay isolated and away from other people.
And do you stay for a lot of time at home or do you go somewhere from time to time?
Most of my time is spent at home. The only time I really leave is to get food or groceries or essentials like, shampoo, toilet paper, toothpaste, stuff like that. Otherwise, I pretty much stay in my house. I'm one of the lucky ones where I live sort of in the middle of a bunch of farms, so I can walk outside, I can enjoy the fresh air without fear of running into, like another person because I live sort of in the middle of nowhere. So I'm lucky that I'm able to do that, but a lot of people who live in cities aren't able to do that.
And do you have different rules for different states?
Yeah, so the US is kind of a mess right now. There's a bunch of different legislation that's being looked at state by state and federally. So for New Jersey, I believe there is a stay-at-home order, which means you are supposed to stay at home unless you have to go for a medical reason or to get groceries or food or something like that. But for other states, like Florida, I think only recently passed that a couple days ago, and their governor was sort of saying that he didn't think it was necessary. He thought that the entire situation was being overblown by the news, and I think only recently he sort of bowed to the pressure politically and said that people should stay at home.
And why do you think it is more people in New York City who has this virus?
New York City has been called the epicenter of the coronavirus in the United States, and I think that it's because it's sort of a worldwide landmark. There's a lot of people that travel there every single day from all over the world, and before the governor Andrew Cuomo put the stay-at-home order into effect, there was still a lot of egress and ingress. So there was a lot of people going in and out of the state, and that may have sort of helped the virus spread even more. And because New York is such a destination in the United
Mhm.
States, I think that sort of allowed the virus to kind of fester and grow without a lot of people realizing what was happening until it was really too late. And now, there are hospitals that are being overwhelmed, especially in New York and New York State. So it's definitely really a lot worse up there than it is in a lot of other places in the United States. Not to say that there aren't other places in the United States that don't have a lot of issues with the coronavirus, because there are.
Mhm.
Florida is, a place that a lot of people are worried about because they didn't have that stay-at-home order. So they're worried about the effects that that's going to have, a few days, a few weeks, even a month from now.
And why do you think you have so many positive tests in the United States?
I think there's a lot of answers to that question, and I think that one of the biggest ones has been the United States federally, like on the federal level of the government, their response to the effects of the virus and their anticipation of the virus was not nearly as competent and not nearly early enough in its implementation as other countries were. So countries like South Korea and
Mhm.
Taiwan have had really good um, isolating effects that they're allowed to implement upon their citizens that sort of curtail the effects of the virus. And the United States didn't do that until it was very, very much late in the game. I think we knew about this virus. I think the first time that it came up on our news was sort of the end of 2019, so the end of December, beginning of January,
Mhm.
and we really didn't start taking the measures that we're taking now until March. And a
Mm-hmm.
lot of other countries took those same measures that we should have taken much earlier, and it really sort of curtailed the effects that the virus had on their countries. And I think that because the United States, with President Trump and just the implementation that his team worked on was much too late and much too little. And even now, it's not nearly enough as far as getting masks to people. We're having to go to the private sector and ask big companies and factories to manufacture these masks, whereas other countries already had big stockpiles ready. So I think that's the main reason that we're seeing so many positive COVID tests, is that we just didn't get a handle on this entire situation early enough, whereas other
Mm-hmm.
countries did.
So you lost a lot of time.
Yeah, I think no one wants to admit that there's a problem when there is one.
Mm-hmm.
And sometimes being the first to admit, or even the second to admit that there is a problem, is a good thing, because that means you get ahead of it. But I feel like a lot of people in power in the United States ignored it for as long as possible, and that just made
Mm-hmm.
it worse.
Mm-hmm.
Having that sort of anticipation in place early on really helps with that. You may take a hit on the economy. People's jobs may take a hit, but they'll recover sooner. And I think that because we lacked that anticipation, our economy and the world economy on some level is going to suffer for a lot longer than it would have had we been more prepared.
Mm-hmm. So do you think people try to unite?
It depends on the situation that you find yourself in. And there are a lot of ways to unite. I mean, you can come together, and there have been a lot of fundraisers that have happened for um, food banks. I know Southern New Jersey, where I live, there's a thing called the South Jersey Food Bank. And there have been a lot of donations towards that to help people who have lost their jobs and can't afford food to be able to get food. And that's always really great to see, is even in these dire situations, people coming together monetarily and also professionally to help others that can't help themselves. And that's happening all over. That's not just happening in Southern New Jersey. There are a ton of stories every day, every week, people thanking medical professionals who have helped them, survive COVID or recover from it, or just thanking them for doing their jobs day in and day out, and for going through what is, I'm sure, an incredible ordeal for them on a personal and a professional level. And it's really nice to see. There's actually there's an American actor, John Krasinski, who was in The Office, and he directed A Quiet Place, the movie that came out a couple years ago. He started this YouTube series called SGN. It stands for
Mm-hmm.
Some Good News. And
Mm-hmm.
it's like a 15-20 minute long episode of just good news that is coming out of this pandemic. And it's sort of like a little spark of goodness each week that people can look forward to. So that's always really nice to see. And there's always a news story every single day. It seems like every single hour about some company. Elon Musk and Tesla are making ventilators, and 3M is producing masks and stuff. And it's great to see people come together and do that, and for the private sector to really get behind
Mm-hmm.
doing stuff like that. But again, like came way too late, I think. And had we had a bigger stockpile, or had we been more prepared, I don't even know if the private sector would have been, it wouldn't have been necessary for them to get as involved as they are. But it is nice to see people come together, which is a positive of any sort of I guess pandemic, is seeing the good in people.
Some positive news.
Yes. And it's really overwhelming as far as the news is concerned, because every time you turn the news on, that's all they're talking about is the bad things, the serious things, which is good to know. But that constant loop of bad,
Mm-hmm.
you start feeling a little overwhelmed, and that can lead to depression, that can lead
Mm-hmm.
to a lot of anxiety and stress. So it's good to take a step away, I think, at least for a little while, and just remember that there is good in the world. My grandmother on my father's side, she lives in a nursing home, and she has dementia. It's it gets worse, it gets better depending on the day. And my parents decided to take her home to live with them, and she watches the TV a lot, and it can be really overwhelming for her to just hear this constant negative stream. So we try to, do things with her and give her, like, spend time with her and talk positive to her. And I think that that's really been helping. Whereas if she had stayed at the nursing home, she might have only been able to watch the TV and might have, suffered some mental or emotional consequences from just focusing on that negative stuff all day.
And wait,
Your cat.
As I understand, you spend your time at home and you're still working, right?
So my job is I handle social media and media production for a small insurance group, like a broker in Southern New Jersey. So a lot of my work happens online anyway. So I'm able to work from home. I have my computer set up right here, and I'm able to just, wake up and get ready and sit down, and I can just work and do most of what I used to do at the office right from my bedroom.
So the situation with the work hasn't changed so much for you.
Yeah, the only thing that changes really is the person to person interactions. Everything's done, over the phone or over the internet. Which I kind of prefer, to be honest. I'm much more of an introvert than I am an extrovert, but I can be extroverted when I have to. And I know that a lot of people who have worked at my office for longer than I have. I've only been here for 6 months. They miss the sort of day-to-day, like getting to see people, getting to interact with people,
to make
right in
hugs.
front of them. Yeah, exactly.
Kisses.
Yes. Yeah, handshakes. So it's not for everyone. It definitely is sort of based on your personality.
And could you tell me about the people who have lost their job?
Yeah, so it's interesting. It depends on if your job is considered essential. So if you are a medical worker, your job is essential. If you work at a grocery store, your job is essential. If you work for an electric company, a sewage company, if you're a lawyer, my job, insurance, that those are all considered essential functions. But if you work at a movie theater, if you work at a convenience store or something that is not considered essential, a lot of those companies have been furloughing their employees, which is not firing them, but just saying, you can't work right now and we can't pay you, but when this is all over, we'll try and bring you back. But also some other people have been getting fired. There was, I think a couple of days ago, it was 6.6 million Americans filed for unemployment, which is, I think, the most in several decades, if not the most ever, that have filed for unemployment. So it is having a really big impact, this whole situation, on people's employers and people's jobs and careers.
How does the government help these people?
So when it became apparent that the virus was affecting so many people so severely, they took, I think, a week or two
To think.
to deliberate, to come up with a plan, and they passed this this thing called the CARES Act. I forget what it stands for, but it's CARES Act. And what that does is it's like a stimulus package for everyone in America. So it's for employers can take out loans from the government with like no interest to keep themselves afloat. And people who are unemployed can file for unemployment benefits, and those benefits have gotten a boost. So for the foreseeable future, they'll be getting, I think it's $600 more than they would have gotten before all of this had started. And I'm not sure about the medical side of things as far as healthcare it goes. I'm lucky enough that I have healthcare through my employer, and we're considered essential, so I still have that, and I'm thankful for that every day. But I'm not sure how that works with other people because the American healthcare system is a giant mess.
And will people receive some support, some money from the government?
The big thing for the CARE Act right now is that every person, I think every person who's over 18 and
Mhm,
has like a valid Social Security card in the United States, and I think who has paid taxes in the last 2 years, either
mhm,
last year or the year before or both. Every single person that qualifies gets $1,200. It, I mean, I think Canada is doing like $2,000 every month for like 3 months. The CARES Act only covers one single payment of $1,200, which for some people will not even cover rent. You know, if
mhm.
if
Yeah.
if they live in an expensive place like LA or New York, which
Mhm,
are two big cities that LA I think is being hit pretty hard by COVID. Not as bad as New York, but those people are suffering, and they're going to need more than this one-time,
mhm,
stimulus to their bank accounts. It's nice and it's a step forward and a step in the right direction, but I think we need to be doing even more.
mm,
There are some stories of landlords that are being incredibly generous and are
mhm,
saying, don't worry about rent for this month or for next month.
mhm,
But not everyone is as generous, and not everyone can afford to do that. So it
mhm,
really depends on your situation, which is why I think having a bill that supports people for longer than just one payment is really important, because it ignores that whole different situation thing and says, here, we will give you what you need because we don't know what everyone needs and we can't provide for everyone specifically. So we'll just do a blanket over everyone to try and provide for them. So I think there's talk of maybe an additional payment down the line if this situation doesn't improve rapidly, which I don't think it will.
And do Americans usually buy a house or a flat, or they usually rent it?
Less and less people are buying houses because either people in my generation, millennials, are not making as much money as the previous generations were making. Like people like the baby boomers and my parents made a lot of money compared to what we're making now when you count for inflation, and they were able to buy houses very cheaply back in the day. And that was sort of the norm: is you got a job, you bought a house, you started a family. Well, now it's like, I don't have enough to buy a house, and I barely have enough to rent an apartment or a flat. So most people in my generation, I would assume, rent. But
Mhm.
if you have a decent paying job, like my brother and his wife have pretty good jobs, they just bought their house like a year and a half ago. So they were able to do that, but that's not the norm for a lot of people.
And how do banks help people now?
A lot of, I think, the bigger banking institutions are very much aware of what's going on, and they're trying to work with people. I know that this is not a bank, but I know that a couple of insurance agencies, some of the bigger ones in the United States, are like um, Safe Farm and Liberty Mutual and a couple of other ones. Apparently, I just saw this today. They are giving back $800 million in insurance premiums for cars because no one's driving. So they'd rather just give that money back to the
Mhm.
customers and keep them as customers than to continue to charge them for something that they don't need. Which is good. I mean, it's great that they're able to do that. But again, not like, I don't have insurance through any of those, so I didn't see any of that money, which would have been nice. But
Mhm.
not every company is going to do that, and certainly not every bank is going to be as open to um, helping out their customers financially. But some are. I think that especially with the CARES Act being passed and the Federal Reserve putting the interest rate for loans down to zero, they're encouraging people to continue uh, buying and selling within the economy as far as loans are concerned. So they want that to happen. We don't want to see another recession like we had in 2008. So the hope is that everything will sort of continue as normal as it can be until we can get out of this.
About your friends, do they have problems with their jobs? Do you have a lot of friends who lost their job?
I am friends with a lot of people in the film and television industry,
Mm-hmm.
and a lot of their jobs are contract based. So they're almost like freelancers where they work a job for a couple months and then they're done and they need to find a new one. A lot of those people have filed for unemployment simply because no one is producing new content right now.
Mm-hmm.
My immediate family is still working,
Mm-hmm.
including
Mm-hmm.
myself, but a lot of my friends and people that I went to school with are out of a job.
And could you tell me about the pupils, students? Do they still study? Will they have exams?
I think it was 3 or 4 weeks ago, a lot of the colleges and public schools and private schools and institutions across the United States started to shut down. So there was a college in Kentucky, Berea College or Berea University, I think, and they shut down entirely and said, we're going to try and move everything online. And they did that way before everyone else. And then slowly all these other schools started doing the same thing. And now we're pretty much at a point where most people are doing tele-education, so just education through the computer. The teachers are mailing or emailing homework home to their
Mm-hmm.
students, and yeah, it's just it's not everyone learns best that way, but it is what it is. And I know that some colleges are just ending the semester, like they're just
Mm-hmm.
wrapping it up as soon as possible. So again, it just depends on the situation that you find yourself in and the situation that the colleges create for themselves by doing that.
And can you tell me about the churches? Are they open now?
The way that the United States is set up, there's this thing called the separation of church and state. It's maybe not as effective as it should be by a long shot, but it's supposed to be that there's a clear, distinctive line between what churches are allowed to do and what the state can force them to do. And most churches, like my parents still go to church, they have their services online. So they
Mm-hmm.
they stream everything, and they are still operating on that end. And a lot of the churches that are maybe newer churches or churches that have websites, at least, you can donate online. So you can just give money to them online. But their doors are physically closed. Now, not every church is doing that, and it's at they're ignoring what the federal government is saying that they should do. Uh, and in light of that, there are some people and some denominations that are still going to have, like Easter Sunday, um,
Mm-hmm.
which is coming up, and celebrations like that, which are fantastic in normal times, to be able to do that and have a community come together like that, but not during a pandemic. And the fact that some churches are still doing that and ignoring what not only the medical community is saying, but also what the federal government is saying that they should do and the precautions that they should take, I think that's not only ignorant on their part, but also dangerous on the parts of their leaders to their congregations.
Mm-hmm. About the
Mm.
prices, do they all the time the same?
I think the items that are biggest in demand, like toilet paper and like chicken, the toilet paper prices have definitely gone up. Not like exorbitant prices, but like it's
Mm-hmm.
gone up a couple dollars. And chicken, I think, has pretty much stayed the same, but they're like always out of chicken. So we've been having a lot of like beef,
Mm-hmm.
and pasta and stuff like that. So my dinners have been very good. But yeah, the prices have been pretty much normal, I would say.
Does the government control the prices?
No, it's all based on, the only thing that the government controls is the tax, and
Mm-hmm.
that's a state-based thing. So like the New Jersey tax is different from like the Delaware tax or something like that.
I see. And you told about the masks. What the situation do you have with masks? Do you have them enough in your state? Do you need to wear it all the time? Do you have to wear it when you go outside?
The last time I went to the grocery store, I wore a mask and I wore gloves, which was the first time I'd done that because I hadn't been out in a couple, I think 2 weeks. And it was within those 2 weeks that it was recommended that anytime you go out, you wear some sort of a mask or covering.
And do people feel it is important to stay at home now?
The large majority of people want to stay at home, and they want to, self-isolate in the hopes that it will help um, overall and help improve cases, help lessen the sting of COVID overall, and help less people to get it. But there are definitely some people, and in my experience, they tend to be older Americans, like 40, 50, 60, 70 plus, that just for some reason don't seem to be taking it very seriously. And they think that a lot of the precautions that people are taking, like the self-isolation, the 6 feet, distancing when you're in public, the masks and everything, they think that it's not necessary, or it's overblown for some reason, and they just don't seem to be understanding the serious consequences of what not doing that stuff can have on not just them, but also if they're carrying the disease or the virus, they can give it to someone else who may possibly die from it. And that's scary. I mean, that's scary for anyone. To be a carrier without knowing it is dangerous, and also it's just extremely thoughtless on the part of someone else who doesn't take any of this stuff seriously.
And what do you think? What mood do people have now? And do you have optimistic or pessimistic people?
I can't speak to anyone but me and probably my immediate family, but I would assume that the feeling is, for someone who's been isolated for a couple weeks, it does get a little unnerving, and it is sort of this daily almost slog where you get up and you're like, oh, I can't like leave my house. I can go outside, but I can't like drive somewhere that I'm not supposed to be. And it does get a little, it's like the claustrophobic almost, like the walls are closing in. And there are some people that are really stuck at home, like they cannot leave because they're in a city, or they're in a very tightly constructed like development or something like that. And some people have kids, some people have elderly that they have to take care of, and some people are dealing with the virus itself. So I think there's a lot of anxiety that's definitely building all over, not just in the United States, but all over. And I know that a lot of people who are prone to depression, like myself, are, dealing with that as best as they can, talking to people, trying to, again, focus on a lot of the good things that are coming out of this rather than focusing solely on the bad. So it really depends on what your personality is like, what your situation is like. But I do think that overall, it's worrying. I mean, there's not a lot normal people can do other than to stay apart from each other and to try and isolate as much as possible. So it's interesting, it's difficult, and it's a little bit scary sometimes, but I think eventually things will go mostly back to normal, but there is going to be some big significant changes, and I think that it can be worrying to think about that.
You are optimistic about the future, aren't you?
Yeah, I'm cautiously optimistic about the future. I think that this entire pandemic shows a lot of the faults in our systems, a lot of the gaps that need to be filled in the future if this were to happen again. To make sure that it doesn't happen this way, and it doesn't happen as badly as it is happening right now in the future. And I think that we can learn from this, and I think that the global community as a whole can learn from this. And I think that that's really important, that we take the steps to focus in on what's happening now so that it doesn't happen again in the future.
Do you see any positive features of this situation?
Yeah, I think that ever since I got forced, ever since a lot of people were forced to work from home, I think that it's really shown that a lot of the traditional ways of doing business and the traditional ways that people thought about having jobs are completely wrong. And in the face of something, like we're dealing with right now with the coronavirus, the use of technology like we're using right now to just communicate and record this conversation is just as effective for some people with certain jobs. So I think that maybe that will help change and spur on certain sectors of the economy to be more open to using technology, to not forcing people to coming into an office every day when they don't have to be, wasting
time for
time,
transport.
money for gas and stuff like that. And that can help, the environment and help people, with their work-life balance. I think that it's actually a really nice thing to be able to see how much better it works for some people. And obviously some other people think that it's, they prefer to be in an office, and that is totally fine. I don't think that will ever go away, but I think having the option to not have to do that if you would prefer not to is really nice. And also it's a good time to, catch up on fiction TV shows, something other than what we're dealing with right now in reality. So I've been watching a lot of TV shows on Netflix and HBO and stuff like that. So it's a good time to catch up on shows that you might have missed, and now we have plenty of time to like binge.
The situation can be like a challenge. You can see what you could do or what you would like to do.
It's definitely a challenge, and it's I think maybe not everyone was prepared for it, but we're going through it anyway. So it's always interesting to see, the daily sort of struggle that some people have, whereas other people are like thriving. Like I'm like, yeah, I'm getting a lot of work done, and my bed's right over here. So the fact that everyone is forced to do it, or most people are forced to do it, really gives credence to the fact that we didn't have to be doing it so traditionally for so long. And I think that a lot of people's bosses or presidents of companies or CEOs of companies are going to maybe take a step back and look at how efficiency is modeled within the office, and saying, okay, well, we just went through this 3-4 month period where we were not being the traditional office workers at all, and we were just as, if not more, efficient. So I think it's going to open up a lot of interesting things. And I think some people aren't going to ignore it completely and just say, nope, it's going to go back to normal, because that's just the way some people are. But
people are different.
Yes, absolutely.
Thank you very much for your interview.
Yeah, no problem.
Nice to speak with you.
Yes, it was great to speak with you too.